Hello from the Highline Park in New York City. I'm Dr. Karen Lee. I'm a Healthy Built Environment Advisor for governments and non-government entities in North America, Latin America, Europe, Asia, and Australia. I'm also Senior Advisor for Healthy Housing and Built Environment Issues for New York City's Health Department, where I work across 12 different agencies and for the last 8 years. Welcome to the first ever FIT conference in Australia. It really grows out of the 2013 Interagency Symposium that was held at Parliament House in Sydney about a year ago. The conferences that we've had here in New York City since 2006 are very much like the conference you're having today. It is a conference that brings together multiple disciplines: architecture, landscape architecture, urban design, planning, transport, parks, real estate, development, and public health, to find collective solutions to the biggest epidemics of our time: obesity, chronic diseases like heart disease and strokes, diabetes and cancers, and motor vehicle injuries. In New York, these conferences have become annual, and we've had eight of them. These conferences are now spreading also to other cities globally. In the United States, they've occurred in Miami and Boston and Louisville, Kentucky, and San Diego. They've occurred in the East and West Coast cities of Canada. London in the UK had a conference in 2013. And in 2015, Sao Paulo is planning to hold one of these conferences. The conferences really have been very instrumental in helping with interagency collaborations and meetings in the city of New York. And multiple collaborations and initiatives have come out of the conferences in New York. For example, after Fit City 1, a new LEED Green Buildings pilot credit called Design for Active Occupants was created through the interagency collaboration of health, buildings, public works, architecture, and green building professionals. After Fit City 2, 12 city agencies in New York City worked together to create the active design guidelines, co-led by 4 agencies: health, public works, planning, and transportation. And the multiple agencies working together, including transportation and planning, on making the city more walkable, more bike-friendly, including integration of more bicycle lanes, bicycle parking, and bicycle share, working with health on health evidence and health-related evaluations, has really led to wonderful outcomes for us in the city. The comprehensive initiatives have had us see things like increased commuter cycling, decreased traffic fatalities, decreased traffic volumes, decreased air pollution around more pedestrianized areas, increased retail sales around more pedestrianized areas. Childhood obesity, the epidemic is now reversed and in reversal in New York City. In New York, our adults have physical activity rates and meeting physical activity recommendation rates that are approximately triple the rest of the United States. And our life expectancy in New York City is increasing at a rate that is faster than the rest of the United States. I also wanted to take this opportunity to congratulate New South Wales on all of the accomplishments over the past year since I was last there in Sydney in 2013. First, my understanding is that the legislation on planning in New South Wales has introduced a new bill to integrate health as an objective directly into planning legislation. So that is very significant internationally and a wonderful precedent, and demonstrates great leadership from the New South Wales government. The New South Wales government, I understand, has also released a healthy eating and active living strategy with walking and cycling strategies that goes towards meeting active living targets in your state plan, New South Wales 2021. You've been working with industry on implementing the healthy and active living credit within your draft Green Star Communities rating tool. So those are all wonderful examples. And the Premier's own Council for Active Living has been doing a wonderful job bringing together government entities, industry, and the community to work together to find these solutions, as we can only find when we do work together. I'm very much looking forward to the next steps in New South Wales, to seeing the draft bill on the health objective and planning legislation passed as law. I'm looking forward to the Walk 21 conference that's going to be going on in October later this year. I'm hoping to be there for that. New South Wales and the City of Sydney are hosting the Walk 21 conference this year. New York City hosted this conference in 2009, and health was a major theme in that conference. And of course, I'm looking forward to seeing many more of these conferences in the years to come, including the progress being made between this year and Fit New South Wales 2015. So again, congratulations. Keep up the great work.